The curved atraumatic tip helps to reduce the risk of trauma on insertion. No epiglottis bars allows easy access for flexible fibre optic devices and tracheal tube introducers. The Portex soft seal cuff is less permeable to nitrous oxide than that of reusable masks, reducing increase in cuff pressure and minimising potential trauma. A higher atrium negates the use of epiglottis bars and contributes to a good seal. The non-return valve seals the cuff pressure. Print on the pilot balloon is a reference for the product size and cuff testing pressures. Clear tubing shows condensation and easy identification of ejected gastric content. Blue line confirms positioning of the tube in the midline. Product information helps assess patient suitability. Integrated pilot line prevents any loose tubing being free inside the mouth, helping to prevent accidental damage. The clear 15mm connector is sturdy in design and conforms to ISO standards. It is recommended that the size of mask chosen will be determined by the weight of the patient. For example, 50 to 70 kg adult female or male, size 4 laryngeal mask. Refer to instructions for use. When the size of the mask has been determined, it should be taken out from the sterile packaging. The tube and cuff should be examined for signs of damage that may have occurred in storage. The tube should be checked for patency. Remove the valve depressor from the inflation valve and check the integrity of the cuff and inflation system prior to insertion by deflating the cuff with a syringe and re-inflating it with the maximum recommended volume of air. Replace the valve depressor onto the inflation valve to allow the cuff to return to atmospheric pressure. Apply sterile water-based gel lubricant to the posterior surface of the laryngeal mask just prior to insertion. Do not lubricate the anterior aspects of the mask to prevent aspiration of excess lubricant or tube occlusion. Remove the valve depressor and ensure the cuff has retained an inflated appearance with no wrinkles or depressions. Once the patient has been suitably prepared to receive the laryngeal mask, the patient is ventilated in order to raise the saturated oxygen levels. Once the soft seal laryngeal mask has been prepared, it is best held at the proximal end, just below the 15mm connector. The slightly larger diameter tube allows greater control when introducing the cuff portion into the patient's mouth. Under direct vision, hold the tube between fingers and thumb and insert the mask into the mouth, whilst pushing the lower jaw downwards. Advance the mask into the oropharynx with a slight twisting motion to negotiate the tongue and tonsils. The tube tip of the partially inflated cuff is positioned behind the incisor teeth. Insert the tube at an angle towards that of the ear. A slight lateral rotation of the tube between 30 and 45 degrees allows the mask to slide over the tongue and prevent the tongue from entering the atrium of the mask. The angle of insertion is maintained as the tube approaches the posterior wall of the pharynx. At this point, the tube naturally rotates to lay flat against the base of the tongue and presenting the blue line in the midline position. From this point, the tube is continued to be pushed in the same direction, as it is generally maneuvered into the hypopharynx. Resistance will be felt as the tip of the mask rests on the upper margins of the esophagus. When the tube is inserted fully into the hypopharyngeal region and the tip of the cuff rests on the upper esophageal margins, this causes air to be displaced within the cuff and assists in creating a seal. When the patient arrives in the recovery area, a breathing circuit can be applied to maintain oxygen levels. If necessary, the posterior pharynx region can be cleared of any secretions with an appropriate suction device prior to the mask being removed. Removal of the Portex soft seal laryngeal mask should occur once normal reflexes have returned. Once the patient has naturally ejected the tube from the hypopharyngeal area, the tube can be discarded.
Whenever there isn't an indication for endotracheal intubation, a laryngeal mask can be used. So any patients when a face mask, for example, can be used, or even when the patient is being ventilated, using controlled ventilation, a laryngeal mask can be used. Advantages of the use of laryngeal mask is relatively easier to insert than learning how to intubate a patient, and also it's less traumatic to the patient, and the patients tend to tolerate a laryngeal mask much better than an endotracheal tube. So a laryngeal mask can be used in the operating theatre, in recovery, in the A&E departments, on wards, and also in cases of emergencies, in accidents in the field. And they are designed to be used for both for adults and pediatrics. The main factors that determine the size of the laryngeal mask is the weight of the patient, the size of the patient, and their build. And there are a variety of sizes that can be used, from neonates, from very small children, to very big adults. The cuff in the laryngeal mask is designed to ensure a good seal around the larynx, and that's very important, especially when the patient is being ventilated. We should be using the minimal possible pressure, just enough to create enough seal to stop any leakage of gases. A maximum pressure should be less than 60 centimeters of water, or equivalent to 45 millimeters of mercury. A transparent clear tube helps in visualization of the mist created by the exhale gases. And also it helps in visualizing any secretions coming up from the patient. And also it helps in visualizing the passage of an endotracheal tube through the laryngeal mask in cases of difficult intubation. The posterior surface of the cuff should be lubricated with a water-based gel. One of the problems with the use of reusable laryngeal masks is that there is evidence to show that even when it's ready for use after sterilization and cleaning, there are deposits of protein on the mask itself. And that's a potential risk of transmitting diseases to the patients. Another problem with the reusable laryngeal masks is that the cuffs are made of rubber material that allows easily the diffusion of nitrous oxide into the cuff, and that causes significant increase in pressure inside the cuff, increasing the incidence of morbidity, including sore throat and bleeding. From the staff point of view, reusable laryngeal masks have to be cleaned and brushed before they are sterilized, and that will increase the risk of transmitting diseases to the staff. The main contraindication of the use of laryngeal mask if the patient has a higher risk of aspiration of stomach contents.